More children in the country will benefit from the added protection of the world's first malaria vaccine through Kenya's Ministry of Health, peering through the Lake region starting from the 7th of March 2023.
Kenya has been participating in the malaria vaccine pilot program that has been going on in Kenya, Ghana and Malawi since 2019.
The protection is a combined effort, bringing together the Ministry of Health and other stakeholders, providing malaria vaccine as part of routine immunization in 26 sub-counties across 8 counties in Western Kenya, namely Homa Bay, Kisumu, Migori, Siaya, Busia, Bungoma, Vihiga and Kakamega counties.
We know is that the vaccine is safe, it's effective, and also it reduces substantially the number of severe malaria cases and also hospital admissions among children who are under 5.
A child gets 4 malaria vaccine doses, the first dose given from 6 months of age, another in the 7th, a third in the 9th month, and the 4th dose at 2 years of age.
Seen very limited hesitancy specifically around the malaria vaccine, and we think that's in part because of the impact of malaria in the communities. Parents know how big of a problem malaria is for their children, and so the prospect of having a vaccine that can address that really reassures them.
In Kenya, the program has been going on in the Lake-Endemic region, 8 counties, that is Migori, Homa Bay, Siaya, Kisumu, Bungoma, Busia, Vihiga and also Kakamega. And Kenya was offering the vaccine in 26 sub-counties. And so far, what we have seen is that coverages for the first dose is above 80%, and for the third dose is above 70%.
Since the vaccine was launched in the Lake-Endemic malaria region of Homa Bay County back in 2019, prevalence dropped by 8%, according to data from the Kenya Malaria Indicator Survey. This being attributed to integrated malaria prevention strategies, including the utilization of long-lasting insecticide-treated nets, prompt diagnosis and treatment.
In some communities, they will still say they don't believe in vaccines because it will ruin their lives. So that resistance has to be there, but I'm really glad that it's now up to 80% uptake, and people are really positive about it. And
what we have seen is the resiliency of the immunization programs to be able to provide the vaccine and their ability to scale the vaccine very quickly. So that's been very positive, and it's really shown the impact of the vaccine.
For a new vaccine that is completely out of the normal immunization schedule, and in interactions with the community, the vaccine is very well accepted. We haven't had a lot of challenges.
Trajectory, we are progressing very well. You can see the youth tumeingia kwa system. We are working with the existing structures to ensure that tunasaidiana na kuhakikisha we achieve the zero malaria in our communities.
Kenya is among 3 African states, that is Malawi and Ghana, where the vaccine is in use, with a substantial drop in children being hospitalized and reduction in child deaths witnessed.
Million doses have been given out to children in those counties, Vihiga, Bungoma, those counties in the Lake region.
We know that the malaria vaccine is not a standalone tool. It's an additional tool in addition to the existing malaria preventive measures.
I think we will be well on our way to trying to eradicate malaria by 2030. All things considered, if we are able to bring to bear new tools like the malaria vaccine. It's an old problem, very old problem, as old as people. It's very difficult to eradicate, but I think we'll be well on our way.
It has been found to prevent about 75% of cases of clinical malaria when provided just prior to the peaky rain season. The Ministry of Health has provided more than 1 million doses of the 4-dose malaria vaccine to children across 8 counties, and close to 400,000 children have received at least 1 dose of the vaccine. Emmanuel Kutosi, Ebru TV.